Hi, I'm Sean and I'm a liver doctor, and you're watching this video because your doctor has asked you to have a liver biopsy. Before watching this video, please consult any information leaflets that you have been provided with for any specific information related to your case. A liver biopsy is a procedure that involves taking a sample of tissue from the liver using a needle. It is usually a day case procedure, which means that people go home the same day. In some cases, however, you may be required to be admitted the night before. The reasons for performing the liver biopsy will have already been discussed with you by your doctor. Then you will be taken into a room with a specialist doctor known as a radiologist, who will explain the procedure, discuss the risks with you, and ask you to sign a consent form which will give permission for them to perform the test. You will be required to change into a hospital gown and lie on a bed in the ultrasound room. The doctor will apply gel to the skin and use an ultrasound probe to identify the best location for the biopsy. This is usually on the right hand side of the abdomen, below or in between the lower ribs. After this, the skin will be cleaned and a small needle will be used to inject local anaesthetic to numb the area. This may sting a little but should not be painful. Following this, a biopsy needle will be inserted through the skin to take a sample of the liver. 2 to 3 samples may be required to obtain as much information as possible. The procedure itself takes around 30 minutes. The risks of the procedure will be discussed by the doctor as part of the consent process. There is a small risk, 1 in 300, of bleeding developing. However, this is usually self-limiting and rarely requires blood transfusion. There is also a similar risk that the needle may damage other core structures within the abdomen. However, this is minimised by the use of an ultrasound probe to guide the needle. Local anaesthetic is used to minimise pain during the procedure. However, when the local anaesthetic wears off, it may be sore around the biopsy site. This can last up to 48 to 72 hours and can be minimised with regular pain relief. After the test, you will be required to lie flat for 6 to 8 hours where you'll be monitored closely. The nurse will take your observations including your blood pressure, heart rate and temperature. After this, most people are able to go home. You may be required to stay overnight.